This is Eduardo Huesca, our Community Outreach and Program Coordinator for the Migrant Farm Worker Program. Extremely busy all the time, and particularly right now in trying to add value to our work with the Kairos Network, which is a project about empowering workers in the context of COVID and other hazards. So Eduardo's going to go ahead and talk about health and safety, worker education, and other prevention work of the Migrant Farm Worker Program. Thanks, Eduardo.
No problem. Thank you. So hi, everyone. Thanks for connecting. And so I was just invited to build a bit off of Michelle's discussion on workers accessing WSIB information and a bit of OHCOW's role in supporting this. So yeah, in this slide, I just wanted kind of to mention in addition, and as Michelle kind of provided an overview around our parachute clinics that we used to run quite extensively across Ontario. We really focused on delivering workshops, occupational health and safety prevention-based workshops directly with farm worker communities. And we were invited onto farms to do so, as well as would connect with community groups to run these workshops in community settings as well. And we focused a lot on also just distributing information, at health fairs, which many organizations that might be tuned into the webinar have themselves put on and invited us. So, we would show up and set up information at display tables and talk to workers about the information. We would do this type of prevention-based education in English and in Spanish. And since the beginning of our program, approximately 1,500 agricultural workers participated in our workshops. But every year before COVID, we would see a lot more and connect and talk to a lot more workers, mostly at the health fairs, right? So we didn't count those as workshop participation, but just engagement and talking about resources and all that. And again, the main focus of this type of this initiative was to really, again, going back to Michelle's data around what we were seeing clinically, was trying to then provide information to prevent what we were seeing clinically. And that's the connection between addressing injuries and illnesses and then trying to learn from that and improve work or change work to prevent, when possible, these situations from happening to other workers. Within the workshops that we focused on, we covered main agricultural hazards. So we did presentations on heat stress and sun safety, pesticide safety, musculoskeletal issues, but we also would provide a beginning of the workshops focusing on what's referred to as occupational health and safety awareness information. And I'm going to kind of touch a little bit more about that in the next slide, but this included, talking to workers about their health and safety rights, about the responsibilities of their employers, and it also included a review of WSIB basics. And what we really encountered in these workshops is that most workers who participated in these workshops or that we engaged with during our information sharing had not really encountered WSIB information before connecting to us. So it really is kind of the crux of the question is, how are we ensuring WSIB information is getting to workers? So this is kind of also, the question is also rooted a bit in terms of trying to figure out, what's working and what might not be working, because this is also in the context of this mandatory education requirement for all workers in Ontario. So beginning in 2014, the Ontario Ministry of Labour identified that all workers in Ontario had to basically take this, basic health and safety orientation training, and that employers had to, facilitate this training for the workers that they hired. And here it's a bit of a breakdown as to what this training for all workers. So many of us would have had to take this as well ourselves. It's all workers in Ontario, including agricultural workers as well. So here you see the breakdown of the information that all workers should be being oriented on, and it includes, the roles of the Ministry of Labour, but also Workplace Safety and Insurance Board of the WSIB. So, there's been a lot of focus around this orientation training and how it's been rolled out, and recognizing that it hasn't really been as effective as it had been intended to. But theoretically, if an orientation like this was occurring, this would be a first point of contact for workers to really get a good sense of health and safety rights, responsibilities, and also WSIB. This is also something to take note of because also by law, employers are supposed to be displaying this poster, and I know many of them I'm sure are, but this is a requirement to have posted in a predominant, I think the wording is predominantly displayed in every workplace covered by WSIB. So this would be another opportunity for workers to kind of get a sense of WSIB and the 1, 2, 3, 4 of what happens in case of injury and illness. So it also kind of opens up the question as to whether these posters are, you know, could benefit from a review with workers as part of an orientation, but it's again the context that we're finding about the disconnect for workers knowing this information, comes in contact with this obligation from the employer. And now I just wanted to share kind of some quick data that we accumulated recently with a partnering organization that we connected to, that we worked with at the beginning of this year. So we partnered with the Ontario Fruit and Vegetable Growers Association on a project that was really meant to identify the COVID-19 resources that agricultural workers had received during the first wave of the pandemic. And the crux of the project was to then identify the information gaps or what information workers felt they still needed or didn't receive information on for the project then to respond and get that information out to communities in accessible ways. And as part of this project, our team really wanted to hear from workers, recognizing that it wasn't a research project, but we focused on trying to interview a small number of workers, but from from 3 of the main cultural communities. So we were able to interview 26 migrant agricultural workers in total, 10 from the Caribbean community, 10 from the Latinx community, and 7 from the Thai community. And the interviews, and there's some folks that are on this webinar that actually conducted the interviews, they lasted about an hour, and the interviews were multi-regional, so the workers that were connected to for the interviews were from across different regions of Ontario. So in terms of the questions we asked workers, we went through a gamut of information topics, both COVID-related information topics, and asked them. And the interviewers were provided training as to how to ask the questions, and the interviews were conducted via phone. So this was a question we specifically asked about WSIB information during COVID and whether workers had received this information. So we had 27 respondents, and as you can see, the majority, or 20 workers, or 74.1%, had not received WSIB information, with just 7 receiving it. And again, these are small numbers, and I've been kind of talking a bit about these numbers in other webinars, but it gives us a bit of a glimpse and was really how the project directed our priorities of what information we need to get out. So this one's an important one too. Again, the number, it switched to 26 respondents, but it really identified that even among some of the workers that had received WSIB information, they still identified that they didn't feel like this was enough information to really understand the topic. The question we asked here was, yeah, did you feel you got enough information on this topic? Do you understand the topic enough, or do you know where to get information, more information if you needed it? And so all workers except for one identified no to this question. So we had a qualitative question that tried to capture a bit of, is there something more you need to know about this topic? So here I've kind of pasted some of the responses of workers. So, they range from, what is this all about? What benefits can we get? To say, I do not have any information about this topic. We don't know anything about this topic. Yes, I would like to know more about this topic. I've heard from some coworkers talking about this, but I have not received any formal information personally. In Guatemala, we were told we had, if we had any problems, to reach out to our employer. So we looked at obviously the responses and a bit of these qualitative responses to really get a sense of that WSIB information was definitely something that at least a small group of workers, but reflecting what Michelle has talked about in terms of her experience, before COVID, that this was definitely an area of information that workers weren't getting and were interested in receiving. So the project itself then kind of started to engage with WSIB and trying to develop, and also on this call are a few people from this project, but we did an inventory of what WSIB information existed and distributed that to employers, as well as to worker groups. But also we were looking at trying to make some of the resources more accessible. So WSIB was able to provide us a set of slide decks that they gave us the okay to turn into videos. both in English and in Spanish. So these are more recently finished, so they're available, but haven't been haven't been circulated extensively. I think yesterday I checked that the views on them are quite low, but they become kind of a resource among others to try to start getting some of this information out. Again, it doesn't. We want to recognize the limitations of tools like this, or information tools like this, because as Michelle noted, the navigation of WSIB, the complicatedness in terms of the decision for workers to either file a claim, and then the process, if they do, the navigation of it is quite complex. So there's still, as Michelle pointed, there's still a lot of need to identify, the assistance support for workers, and almost, navigation or guidance around that as well. And I'm going to hurry up because I know we want to get to some more discussion, but I did want to root this back into the idea of prevention. So this writing comes out of the workbook from that mandatory Ministry of Labor training that all workers are supposed to get. And as you can see here, it really identifies that, there's a hazard at the root of every workplace related death, injury, or sickness or illness. And this is really prompting workers to understand, hazards, to educate them, to be educated on the hazards, be aware of the hazards, connecting again to this idea that, understanding the hazards is a really understanding and addressing the hazards is a key part of ensuring that we can prevent deaths, injuries, and illnesses. So I think that's kind of a notion that we've really focused on through our workshops, as well as to talk about how to prevent some of these things, some of these hazards, and through our workshops and different initiatives. But I think what becomes really important is to obviously root this in the employer's responsibilities. And here I've kind of included some of, under the occupational health and safety, what are some key employer responsibilities. So, as we're, supporting injured or ill workers, it again comes back to the idea of ensuring that we're focused on preventing, right? And so here you kind of recognize that employers' responsibilities of informing workers about the dangers at their work, creating in the context of COVID-19 safety plans that explain, enforce, set the rules, assess whether a safety plan is working at the workplace, and really a focus on keeping workers safe. And this kind of responsibility, the third one, is really important in terms of the employer's responsibility to do everything reasonable to keep workers from getting hurt or sick on the job. And I think that's kind of a core and fundamental one too, as well as supporting health and safety reps and joint health and safety committees that are supposed to be on farms, depending on the type of farm, and really supporting those reps and committees to really do important work at the workplace, which includes inspections, consultation, making recommendations, and addressing concerns that come up. So I think this is such integral for us to continue working on this, to ensure that that this is really a key piece of the work that we move forward. This is kind of a slide put together by the Ministry of Labor as well, and this is kind of an interesting connection between in the occurrence where a worker does become sick with COVID, or contracts COVID, becomes sick with COVID-19, or test positive. There's a requirement for that employer to report this to the Ministry of Labor. So this is in addition to WSIB and receiving the support for workers who are ill or have not or had to stop working. This is a reporting for the Ministry of Labor to then investigate, the workplace exposures and illness. And so this is really situated to really understand what could have went wrong, again with the same lens as preventing it, right? And so the ministry did a few webinars since the beginning of the pandemic to try to take what is known about the outbreaks that have happened and try to work towards providing more specific guidance and health and safety practices. And I think all of this has to be really rooted in a context that, we have to focus on continuing to grow workplace and industry cultures that are supportive of worker occupational health and safety empowerment. So under COVID, we've just seen, the importance of workers speaking out if they experience symptoms or illness right away to protect against workplace outbreaks. The importance of workers speaking out if they see, procedural gaps or COVID-19 hazards that might not be seen by supervisors. And that's such an important part of assessing and reassessing and improving workplace safety measures to protect from COVID and other hazards. But for this to really happen, workers have to feel confident in engaging with health and safety. They have to, be comfortable, and that really then requires a workplace culture that is actively supported by employers and supervisors to really ensure that workers are active and confident in that way. This really has to be in the context of a clear commitment to anti-reprisals. So as Michelle talked about, this continues to be a big challenge with workers fearing that they're going to be either punished, sent home, or not being asked back. And then, this is again some lines from the lines from the health and safety workbook, the awareness training workbook, but it clearly states, that a worker, you should never have to worry that you will get in trouble for asking questions or reporting a problem. It's against the law for your employer or your supervisor to punish you in any way for doing that. And even, and explaining that this is called a reprisal. And so, the Ministry of Labor talks about this, talks about anti-reprisals and what to do with when workers, encounter or feel like they're being reprised against. As we know, this system is far from perfect still, and I know Michelle's spoken about resources from legal clinics as well as being a key part of this, and other community stakeholders who can support. But it's definitely important to come at this with information about anti-reprisals for workers as well, as we continue to work with employers and workers to build that culture that I mentioned. And so we spoke to Kendra a bit about this in terms of WSIB and reprisals, and kind of what happens whether a worker, if a worker is feeling like they're being threatened or punished for putting in a claim. And so this was kind of an information that Kendra shared. So I threw it into this slide as well and included the link. But it seems to come under WSIB's focus on reporting fraud or abuse of the system, and under examples of businesses, it notes failing to report an accident or discouraging an employee to report an accident. So on the website, that's a bit of maybe what that touches on. If a worker feels that they're being discouraged to report a claim, and it includes here a phone number and an email that workers then can connect to this. And I think Kendra called it the tip line, and it says that's a resource as well that I think is important to get out and share. So I think that's all from me, and thank you.
Thank you, Eduardo. It's a lot of information, but it's quite valuable. We don't actually have any questions, but I would invite people to turn on their video and their microphones if they have a question for any of the presenters.